The gentleman yields back. The gentleman from Kentucky.
Thank you, Mr. Speaker. I really appreciate the recognition, and I yield myself as much time as I may consume.
The gentleman is recognized.
Thank you, Mr. Speaker. One of the points that my friend from California just brought up, we have this 3-year running telehealth. It's moving forward. We all know that we can't put the genie back in the bottle. We have to work on telehealth. But we know for a fact there have been diversion of controlled substances through telehealth. We know that. And so why don't we take back our authority? Let's negotiate moving forward. Let's think about where this has gone. 3 years ago today, Secretary Azar, 2 administrations, declares a public health emergency, and it started doing a lot of things. One, that it allowed emergency use authorization, so we had therapeutics, we had all these things come forward. Also the status, not necessarily every statute under Health and Human Services, but because you have the status of a public health emergency, you can invoke other statutes. The President, Defense Production Act, President Trump to get respirators, moving a ship outside of New York so that people in New York and New Jersey could have an extra hospital, a mobile hospital. I mean, all of those things happen. That's what when we delegate our authority, those are the things that we move forward. On January 20th, 2021, almost 1 million people were being vaccinated. President Biden came in to continue the vaccination process. And then we're a year into his administration, we, on our side of the aisle, send a letter to the Health and Human Services Secretary saying, this needs to end. We can't continue to operate under emergency authority. Let's have a plan. Everything that they've talked about today on every speaker that they've had, let's have a plan to end this emergency, and let's do it in a way that we can address the issues that need to be addressed. We learned a lot during the pandemic of things that work. Let's do things that work. Let's fix things that don't work, like the telehealth diversion of controlled substances. And so those are the things. We've been a year in. It's February the 1st tomorrow, almost a year since then, and we haven't seen a plan. We haven't seen anything. There was some stuff done, I know, in the omnibus, but those and with telehealth. But that's what we're saying. We don't need to continue to operate the country in an emergency status. We need to end it. And so why bring the bill up? Did they say this irresponsible bill moving forward? The bill was in rules last night. This bill was in rules last night. We've had no word from anybody in the executive branch that they're going to deal with this. While the bill was being considered in rules, they come out that it's going to end on May the 11th. And so this bill is needed. It is needed because it's moving us forward. And so what we can do now as the bill makes its way to the Senate, I don't know if the Senate's going to take it up or not, but what I will pledge to my friend from New Jersey and my friend from California, who's the ranking Democrat on Health and Human Services, or the Health Subcommittee, that we'll work to make sure we find the areas that we need to continue, the lessons that we learned that we need to put into place in the statute, and to take care of things that need to be taken care of. But what we don't need to do is allow just a carte blanche 3-year open emergency pandemic that we know has had issues as well. I mean, we always talk about the things we want to keep. We can talk about those and work on them. The things that we need to address using telehealth to divert controlled substances, and we know that has taken place. There are examples of that. We absolutely need to address that. And I will pledge that we will work on our side of the aisle with our friends on the other side of the aisle to find things to make sure that we continue to address the fact that we still have COVID-19. And one thing to note is we're still going to have COVID-19, and we don't need it coming across our border. So it's because we're doing this, we also still need to keep the Title 42 in place. And so, but I look forward to working together. This is necessary. It's moved this administration hopefully forward. We can say that May 11th we move forward on this, and I'm proud to be the sponsor of it, and I urge my colleagues to support it, and I'll yield back the balance of my time.